Anyone who has watched our YouTube channel knows that I am no fan of Advantage plans, and for good reasons. However, our company still writes Advantage plans, sets people up on those plans because sometimes it is their only and best option and they still have decent insurance. However, when someone can afford just a little extra on a monthly basis to pay a premium for a supplemental plan, they're going to have excellent insurance. Now, certainly they're not going to have any perks like Advantage plans offer, but they're also not going to have pre-authorizations. In other words, the insurance company can run no interference at all. They're also not going to have any provider issues whatsoever because they have no network. They can go anywhere that takes Medicare. So I know they're going to have no problems anywhere in the country. They have a permanent lifetime policy. Now, that being said, we have to make sure, though, that when we go on a supplemental plan, we are selecting the right company. And so in this video, I'm going to share with you some issues, really some dangers that you must be aware of to make sure that when you choose a supplemental plan, you have chosen the right one. Now, this hidden danger really revolves around the issues of selecting the right supplemental plan, starting it at the right time, and then the rules for switching plans when that is necessary. All right, so those are the topics we're going to cover here in this video. So number one, the first thing we have to be aware of is this enrollment danger. That danger is missing what we refer to as the Medigap OEP. Now, Medigap is synonymous for a Medicare supplemental plan. So as I talk about in the video, I'm talking about the same product. All right. Now, this OEP stands for Open Enrollment Period. Now, what's very unique about this particular Open Enrollment Period, it centers around your Medicare eligibility, specifically your Medicare B date. All right. And so we don't want to miss this once in a lifetime opportunity called the Medigap Open Enrollment Period. So now let me explain. First off, there are some of you that are going to start Medicare at 65. Now, by the way, everyone has to start Medicare at 65, except for those that are covered by their employer plan or their spouse's employer plan. And the key is there has to be 20 employees on the payroll or more. Okay, that group of people, you or your spouse covered by a group plan, 20 employees or more on the payroll, you don't have to do anything at all with Medicare. Everyone else, you have to. So if you're on a retirement plan, or you have no insurance, or you're covered by TRICARE, or you have an ACA plan, or you're on COBRA insurance, or you're in a group plan, 19 or less employees on the payroll, you have to start Medicare at 65. Okay, we call this your initial enrollment period. And unless you're on Social Security, you actually are going to have to initiate this enrollment at 65. Those people that are on Social Security will be automatically enrolled right before this initial enrollment period begins. So let me explain what I'm talking about. Let's just say that someone has a birthday today, they're turning 65. I'm shooting this video. Today is January the 11th of 2024. That's the day today I'm shooting this video. And so let's say that someone's turning 65 today. What does that mean? It means that they were born 1/11 in 1959, all right? And so they're 65 today, and so they would be eligible to begin their Medicare today. And so if they're going to start their Medicare at 65, they're coming in during this initial enrollment period that only last for 7 months. So let me give you an example. So we said that they could start their Medicare A and B 1/1 of 2024. If they have to self-enroll, they could have done that 3 months before, this month, or 3 months after. Now, the key is if I have to start at 65, I should do it in advance. So in this example, that would be we could have started Medicare enrollment October, November, December, and we would have an effective date on A and B of 1/1/24. Now, if I put this enrollment off, what happens is they start putting off my B date. And so let me explain what I mean by that. So if I enroll into Medicare in January with a January birth date, they're going to start me in February. If I enroll in February, they start my B date in March. March enrollment, they'll start me in April. April will be my very last month of the 7, and then they would start my B 5/1. And so my whole point is we have this 7-month window where we can enroll into Medicare. And this example then would give us this 1/1/2024 for our A date and our B date. So when that Medicare card shows up in the mail, it's going to say hospital, Part A. It'll have an effective date 1/1/2024, and it's going to have a medical, which is the outpatient side. It'll say medical, Part B, Part B, this was Part A, and it's going to say 1/1/2024. So when we start at 65, we have now this opportunity called the Medigap Open Enrollment Period, and it is tied to our B date. Now, it just so happens in this example, because we're starting at 65 and we enrolled in advance, our A and B dates are going to be the same. But what I'm trying to teach you is this is tied, this once-in-a-lifetime opportunity is tied to the B date. All right, so what we have is now we have the opportunity to get any Medigap policy that is sold in your state from any carrier that's available in your state. There's no underwriting required. We'll ask you no health questions. They have to approve the policy. They have to cover all your pre-existing conditions. But this opportunity only lasts for 6 months. And again, it's tied to the B date. So in this example, what would that 6-month window be? It would be all of January, February, March, April, May, and then June. So those are 6 months. So anytime from January 1 to the end of June, if we apply for a Medigap policy, it will be issued. But what happens after that 6-month window is closed, in this example from 7/1/2024, moving forward, my 6-month window is closed, and now in the majority of states, which you'll see in just a minute, you are going to have to medically qualify to pick up a Medicare supplemental plan. All right? And so that's why we're saying you do not want to miss this opportunity, especially those of you that may have some health issues or maybe some things that you were concerned about coming up because of family history or whatever. But the point is, you don't want to miss this opportunity, and it's tied to the B date whenever you start that. Now, from a practical standpoint, we don't have to apply for a Medicare supplemental plan in January to begin the 6th month. Most carriers will allow us to actually submit a Medigap policy application anywhere from 3 to 6 months before the B date. In fact, that's what most people do. They do this in advance, and it's fine to do the supplemental application. There will be no underwriting. That policy won't go into effect until the B date goes into effect, but you can do it in advance. But if I don't, I still have this 6-month window where there's no health questions asked, but that 6-month window is closed, and I lost the opportunity in this example if I wait till after July. And that's for those of you that are going to start your Medicare at 65, called the initial enrollment period. Now, the question is, does everyone start Medicare at 65? And certainly the answer to that is no. So let me show you what happens for those of you who don't begin after 65. How can you use the Medigap OEP? Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. So let's now address those of you that are going to start Medicare after 65. Why did you do that? Well, because you were covered by an employer-provided plan. It's either your plan at work or your spouse's work plan that you like. You like the cost of the plan, you like the coverage of the plan, so you made the decision to stay on the group plan, which is fine. And you can come into Medicare down the road with no penalties, no problems. I'll explain how that's going to happen. But remember the key to this. There has to be 20 employees on the payroll or more for you to be able to start Medicare after 65. So when we do, we come in using a different enrollment period. Remember, this one was called the initial enrollment period, which lasted how long? 7 months. Now we're saying, let's say you're 67 years old now. Now you're going to come in differently. You're going to come in using what we call the special enrollment period. Now this is different because what we have now is we have some additional paperwork. And so again, let's use the example, someone coming in at 67 years old, they're going to start Medicare, they've stayed on the group plan 2 years, now they're going to retire. So what has to happen, if it's at 67, we got to go back to 65, and we have to prove that you've had a credible coverage at work, someone's been working, you or your spouse, covered by a group plan with no gaps in coverage whatsoever. Okay, we can be missing no months, and the way we prove that is with the form called an L564. That's the form we use. By the way, you work with our firm, we do all this for you and with you. This form would be then sent to your HR department that will verify this, and then we fill out another form called the CMS 40B, and with this form, we actually select the month when we want to start our Medicare coverage. Up here, when we enrolled, determine when we start. When we use the SEP, we actually get to put on the form, we want to start our Medicare coverage, and then you just let them know the date. So those are the two forms that we have to use here that we didn't have to use up here. So if I'm going to start Medicare after 65, and again, I'm teaching you about this Medigap Open Enrollment Period, your once-in-a-lifetime opportunity. Now what we have is this. Now it could be that someone enrolled into A only. So let's go back to our example. Someone's turning 65 in January. They have a good group plan, but they decide to enroll into A only. So they establish their A date. 1/1/2024 in this example, but they didn't take B because they had a good group plan. Now, I do want to give you a quick caution about taking A only. Having A only is not a problem except one area, and that is if you're still working, spouse still working, covered by a group health plan that has an HSA, health savings account attached to it, you don't want to take A only because you can no longer put money into your HSA account. Now, the money you have in there is your money, but no new money can go in. It's wonderful to have an HSA because it's all tax deductible, tax exempt, tax deferred, as long as you use it for medical expenses. And so those are really wonderful plans. But if you enroll in any form of Medicare, A, B, or both, you can no longer put any new money into your HSA. So I would rather have the HSA and say nothing to Medicare, not do anything with Medicare. You will not be penalized as long as your Medicare A is free, which almost for all people it is. You won't be penalized. Go ahead and keep contributing to your HSA. In 2024, those limits are $4,150. Plus, because you're over 55, you can put an extra $1,000 in. That $4,150 will be doubled if you're contributing to a family HSA. And so I like HSAs, and so keep contributing to that, and you will not be penalized when you pick up Medicare at a later date, as long as your A is zero premium, which means you have 40 quarters, 10 years worth of taxes paid into the Medicare system. You will never be penalized for your Medicare A. So when I have A only, how that's going to work is because my group plan is 20 or more, my group plan is always going to pay first, and Medicare A is going to pay second. And so they may pay something. I will tell you this, if you do enroll in A only, in the second payer position, Medicare will not pay any deductibles, they will not pay any co-pays, but they are open to paying co-insurance, and you may have some of that on your group plan if you're hospitalized. So it is fine to enroll in A only, in my opinion, as long as you just don't have that HSA. Flexible spending, FSA, flexible spending accounts are fine, health reimbursement arrangements are fine, just not HSAs. That would no longer allow you to put money into your HSA. So in this example, this person took A only, and then they worked 2 more years. And now they want to start their Medicare at age 67, and so their B date is going to be 1/1/2026, all right? So they had A only, and now they signed up for B using the special enrollment period, the paperwork and process, all that's involved, and now our Medigap Open Enrollment Period is going to begin. Why? Because, again, it's tied to the B date. So what do we have? Again, we can apply 3 to 6 months in advance. The policy, Medigap policy would start on our B date, and then we still have 6 more months, and that would be what? January, February, March, April, May, June. So again, in this example, 7/1/2026 on. Now, if I want to pick up a Medigap policy now, I'm going to have to medically qualify in most states, and I'll explain that next. So my whole point in all this is, folks, that is the number one danger, missing that Medigap Open Enrollment Period. Why? Because it's a once-in-a-lifetime opportunity in most states. All right, that brings us into the second aspect around this hidden danger, and that is this, and that would be what I call the insurance company danger, and that is you choosing the wrong carrier. Choosing the wrong carrier. And that happens from time to time, and I'll show you how to avoid doing that. All right, now let's talk about 2 parts of this particular issue, and that is, number one, Medigap plans are, look at this key word here, they are standardized by Medicare, which means Medicare sets all the rules. Right now, there are actually 10 supplemental plans on the market. They're all given a letter. Medicare Supplemental Plan A, B, C, D, F, G, K, L, M, and N. Now, unless you're born before January 1st, 1955, you wouldn't be eligible to have it the F or the C plan. Those people that are born after January 1st, 55, which means they started Medicare after January 1, 2020, they cannot have the F or C, but they can have all the other letters. They can have the A and the B, the D, they can have the G, they can have the K, L, M, and N. So there's 8 possible supplemental plans for them. But the whole point is this, they are standardized by Medicare. Each of those letters represents a different Medigap policy, and each of those letters just simply means this policy will pay these amount of bills and will not pay these amount of bills. So the standardization of the plan sets the rules for what bills are paid and what bills are not going to be paid by that supplemental plan, which simply means this. Right now, the top plan is the G plan. So if you buy that G plan from, let's say, United Healthcare, Mutual of Omaha, or Cigna, or Aetna, or Anthem, Blue Cross, whoever you buy it from, any company that makes it available in your state, if you buy that G plan, the coverage is the same. we would never say, let's go with this carrier because they're going to pay bills better, because that's not true. They're all going to pay the same thing. As long as Medicare pays first, no matter who you bought that G plan from, that G plan is going to cover everything but the B deductible. That's how the G plan works. All right. So it covers everything but B deductible. So no matter who I buy it from, my coverage is going to be the same. All right. So that's standardization. So let's just talk about the top two plans. Again, the G plan and the N plan are your top plans. I think G plan is still a little bit more popular than N, but they're both good plans. So here's the difference. The G plan is going to cover 5 of the 6 gaps in Medicare. I've got plenty of teaching on this channel to talk about those gaps, so I'm not going to go into that other than to say there are 6 gaps, 3 gaps on the A, 3 gaps on the B. You're responsible for those financially. You have the opportunity to take some of that financial liability and transfer it to an insurance company. You pay the insurance company a premium, they take that liability from you, and with the G plan, they're taking 5 of the 6 gaps. The one they will not cover on the G plan is what we call the Medicare B deductible. This is an annual amount, calendar year deductible. This year, 2024, it is $240, and it's one time for the whole year. So as long as Medicare pays, that's the only thing you would ever pay. Everything else is 100% coverage. Okay, that standardized G plan, standardized N plan, covers 4 of the 6 gaps in Medicare. For the 6. So your premium is going to be about $30 cheaper a month, but you have a little bit more liability. So what it will not cover, it's going to cover 4. So the 2 it won't cover. Same thing as the G, and that it will not cover B deductible. So that's out of your pocket. And then it will not cover when it happens. And it doesn't happen often, but there's a thing called an excess charge. This will happen, honestly, probably less than 5% of the time. Most doctors will take Medicare-approved amounts as payment in full. They won't add to the bill, but there are sometimes a doctor will add to the bill. Again, about less than 5% chance. It can happen, and that excess charge you would have to pay if it ever happened if you have the N plan. The most they can add is 15% of the bill, and you would pay that. That's what I mean by 2 gaps they won't pay. The B deductible, the excess charge of the G pays everything but the B deductible. So G would cover that. N does not. The other thing that N requires you to do, every time you see a doctor, you're subject to a $20 copay. Every time you go to the emergency room, you'd be subject to a $50 copay. So again, we saved about $360 a year in premium, thereabouts. That's going to vary state to state, but we just took on a little bit more liability. And some people are happy with that. They're comfortable with that. Others say, nah, I don't want the possibility of excess, even though it's small. I don't want the risk, and I don't have any copays. I want the best coverage, or I'll say it this way, the most comprehensive coverage I can get. Then that would be the G plan. Both are fine. There's a slight difference, of course, in the monthly premium. That's a decision you have to make. All right, so we see the plans are clearly standardized, but what's not standardized would be the premiums. Medigap premiums are not standardized. These are determined by the individual insurance company. So coverage will be the same by those carriers, but the premiums will not. You'll see a variance anywhere sometimes between $10 to maybe $50 a month between all the carriers in any given market. And so what you want to do, you want to make sure that you selected the right carrier. Now, there's a couple things about carriers. Number one, what they'll always do is they will offer you your initial rate. Now, most carriers lock in that initial rate, that 12-month rate that when you come into the plan at 65 or 67, they'll give you a rate, and that rate's pretty well locked in then for 12 months. But all of them are going to go up. And folks, you got to realize, really in any kind of an insurance product, even Advantage plans that are 0 premium still go up, and copays or go up and max out of pockets. And so things are going to go up. Why? Because of medical inflation. That medical inflation is going to have an effect upon every plan. The way it affects supplemental plans is we're going to see increases. But what you're looking for is, yes, a very good initial rate, but what you want to do is this. You're looking for a company that has stability of rates. Okay, I do care about the initial rate, but I care more about what do I think that rate's going to look like in 3, 5, or 10 years down the road. Because there are some companies that tend to take more frequent increases, price increases, and more drastic price increases. And so what we do is we track that. You work with us, you'll see this. We'll show you the history of price increases with these carriers because we think history will repeat itself. And so we see a company that's been stable in the past, more than likely going to be stable in the future. Again, they're all going up, but we want a company that's proven to be very stable. Now, one of the keys that we look at is this. We like to look at a company that is more of a national carrier. National. Now, I'm not saying that every regional carrier is not as stable, but sometimes they're not. So, not a real fan of regional carriers. I like national carriers. The second thing I like to look at is a carrier that has a large market share. In other words, they are a dominant player within the market. I recently had one of my agents who was looking at a market, and there was a plan that I think had like 30,000 policyholders in an area, and there was another carrier that had like 500. Huge difference. That 500, you're in that group, you're really putting yourself in a very risky position. Not enough policyholders really to spread the risk out. So again, that's what we're talking about. So I like national carriers that have a good market share, meaning they're very competitive in that market. And I'm going to tell you why. Let me get kind of a silly illustration here. But let me illustrate this way. Let's say that you were in a canoe, and you're in the canoe, and you happen to be in an ocean in this canoe. Well, you're going to feel every single wave, even small waves, certainly the huge waves, that hits against that canoe. In fact, you're probably going to topple over. Because why? Very small boat in a very large body of water. But if you're in that same ocean and you're in a cruise ship, an ocean liner, you don't even know you're in the water. It's just usually some very smooth sailing. And that's really what it can be when it comes to supplemental plans. So if I go into a company that has this little small block of business, I'm in the canoe. If I have a lot of health problems in there, not me personally, but others, knee replacements, other joint replacements, cancer issues, other heart-related matters, small block, we're going to feel the impact of those health problems. But if I'm out here and I'm in a large block, national carrier, that has more policyholders, then more than likely we're going to have health problems for sure. We're not going to feel the impact of that as much. And that's what we're looking for. Yes, I care about initial rates, but I really care about stability. So again, when I talk about choosing the wrong carrier, I'm not saying the carrier is a bad carrier. I'm just saying to you what I'm looking for is a carrier that is proven to be stable. And these are the two ways that typically will give us stability of rates. Hey, Medicare can be very confusing. In fact, people make mistakes all the time because of how confusing it is. So what I've done is I've actually created a Medicare, notice this, Essentials Workshop, where you have the opportunity to really learn everything that you need to know about Medicare so that you can make Medicare decisions. There are thousands of people every month that watch this workshop, and we get lots of reviews saying that this is something that really was helpful to them. And so what you can do is down here below in the comments section, you'll see where it says pinned comment. At the very top of those pinned comments is a link. And you click on that link, what we're going to do is we're going to give you free access to this Medicare Essentials Workshop. And we want you to watch it because we don't want you to make any mistakes. All right, that brings us into the third critical issue here. That is what I call the switching danger. And this is really when someone has a misunderstanding of the rules for switching plans, okay? And I see this all the time. People get into a plan, and because Medicare has this open enrollment season where there's all kinds of ads, online or TV or through the mail, everyone thinks, well, we can just switch these plans and there's no rules, and that's just not true, folks. And so you have to really understand the switching rules when it comes to Medigap policies, and specifically for your state. I'm going to get in that here in just a second. So the first thing when I talk about rules for switching, we have to understand that there are federal guidelines. Federal guidelines means the federal government, through the Department of Health and Human Services, CMS, Center for Medicare, Medicaid Services, has set the bar. And they're saying no one, meaning an insurance company, cannot offer a Medicare supplemental plan that would be less than the bar, less than the federal guidelines, okay? Now, the federal guidelines, what they say is this: everyone has a Medigap Open Enrollment Period. I just taught you about that. That is called 6 months. And during that 6 months, federal guidelines says there can be no underwriting whatsoever. Now, one thing that's interesting about this is the federal guideline doesn't say that people that come into Medicare under 65 because of disability, they may not be able to get a Medigap policy. Now, some states make them, but not all states do that. So that's the point. Some of you watching this, you may be 60 coming to Medicare because you've been on Social Security disability, and you may find in your state you cannot buy a Medigap policy. Now, keep in mind, you may not be able to buy it now. You can always get an Advantage plan, but when you turn 65, then you can get that Medigap policy. And again, there are some states that raise the bar above the federal guideline, but I'm just teaching you about the federal guideline. People turning 65, everyone gets this 6-month window. Now, another factor could be if someone is losing. They're losing an employer plan. Now, let me explain. This losing employer plan means this plan has entirely terminated, meaning That company went out of business. The plan is not even available whatsoever. Then someone would have about a 60-day window to pick up a Medigap policy if they were covered by some type of retiree plan that is no longer available. Those are the federal guidelines. All right. So everyone has to stick to that. But there are some states that actually raise the bar. They have rules and ways for people to get supplemental plans that are a little bit more generous to the consumer. It can never be less than federal guidelines, but it can be better than federal guidelines. So we call these state guidelines. And I'm going to show you some of those very specific items. Now, one thing that's interesting about this one, remember we said this plan, if it's terminated, you have 60 days to get that Medigap policy if you were on a retiree type plan. There are state guidelines, actually 20 of them, that say this. They raise the bar a little bit and they say if in any way you involuntarily lost the plan, okay, doesn't mean it terminated, but it was involuntarily lost, then 28 states say you have another one of these opportunities, 60-day window, to get a Medigap policy. So that's what I mean by state-specific guidelines. Now, I'm going to give you more about those in just a second, but what I'm trying to teach you, though, is that you and I just can't switch haphazardly, randomly, just because we want to. No, we have to follow the rules. Either those rules will be federal guidelines or they'll be state-specific guidelines. All right, so let's look at some specific state guidelines. All right, now let's look at those specific states. There's actually 14 of them. 36 of them follow the federal guidelines only. 14 of them have state-specific guidelines about switching plans. Now, the most generous states would be the state of New York and Connecticut. And no, with this, we have this time period way beyond the 6 months, because all year long you can switch your Medigap policies, Medicare Supplemental Plans, and any plan that's available in your state would be available for you to switch to, and any carrier that's offering coverage in those particular states. So again, very, very generous, almost no rules at all, other than, of course, you got to be eligible for Medicare. All right, now next we'll look at Maine. Now, Maine's unique in that they have this period of time, but notice the switching period is during the month of June, where there is no underwriting whatsoever, and you have to be on a Medigap policy. But notice you can move to an equal policy. So if I'm on a G, I can move to a G, or if I'm on a G, I can move to an N. If you're on an F plan, you can move to a G or an N. So that's what I mean by a equal plan or lesser. Can't improve in benefits, but you can stay the same or go down. And again, any carrier that's available in the state of Maine would have to offer that to you. Then we go to Vermont. Again, all year long, just like Connecticut and New York. But notice there's some restrictions in Vermont. Again, equal or lesser, same or go down, but notice there's only 2 carriers that have to offer these guaranteed issue rights to you, and they must, and that would be United Healthcare and Mutual of Omaha. All right, now let's look at 6 states that are very similar. Now, what I want to draw your attention to, because I'm going to read everything on the chart other than to say, if you will, kind of find out, is this one of the 6 states in which you live in? All of these states have what we call a birthday rule, which means they give you the opportunity to be able to switch your Medigap policy, and that time period revolves around your birthday. And these birthday rules are going to vary state to state. I'll show you that. So what they're saying is that you already own a Medigap policy, and now you want to switch that policy and even carrier. And so you have to make that switch with no underwriting around the birthday. Now keep this in mind, folks. We can switch Medigap policies even in these states other times, but what happens? We got to medically qualify to make the switch. So if someone has health problems, they probably are going to do it during this particular window. So again, you can see California from your birthday, 30 days before birthday, 60 days after, no underwriting. Oregon, from your birthday forward, 31 days after birthday. Idaho, 63 days after your birthday. Nevada, 61 days. Oklahoma, 60 days. Maryland, 31 days. So once the birthday begins, we have this window of time where we make an application. The insurance company has to approve it. As long as we're within this window, no health questions asked. They're going to cover all your pre-existing conditions because there's no underwriting involved whatsoever. And again, you'll notice the common denominator. We move to an equal plan or a lesser plan. And again, any care offered in that state. All right, just my last 4 here, and then we'll close this up. So number 1 here in this last list of 4 is Illinois. Now notice what Illinois does. Again, it's a birthday rule state. So starting on your birthday for the next 45 days, you can switch your plan, no underwriting involved at all. But notice this only applies for anyone 65 to 75. That's it. If you're 80, can't do it. 76, couldn't do it without underwriting. But no underwriting for those 65 to 75, equal or lesser again. But notice you have to stay with your current carrier. carrier. So if you're with United Healthcare, you've got to stay with them in making the switch. If you're with Mutual of Omaha or Cigna or Aetna, whoever you're with, yeah, you would switch to that carrier, and you would be able to get that other plan, equal or less, at the best price that's available, no underwriting at all. Secondly here, look at Louisiana. Very similar to Illinois, but a little bit of a longer period of time. Illinois allows 45 days, Louisiana's 90 days. 30 days before my birthday and then 60 days after. I'm in this window of opportunity, equal to less. Again, same carrier only has to approve you. And then we get into Washington. Very interesting with them. It's an all year round. You can switch your Medigap policy. You got to own one. Can't just add one anytime you want, but as long as you own one, you can switch anytime, equal to less. And again, any company that's available in the state of Washington would have to approve your case. No underwriting. And then lastly, state of Missouri. Very similar to birthday rule, but Missouri calls it the anniversary rule. So it's not tied to your birth date, it's tied to the anniversary of your policy. And so I actually talked to someone today in Missouri, and anniversary of their policy was September. So that means they have this 60-day window, 30 days before anniversary, 30 days after. So their anniversary was September 1. So anytime in August or all of September, they can apply for a Medigap policy. Again, equal only though in Missouri. So they have to move G to G. They couldn't make a move from a G to an N without underwriting. But G to G, N to N, F to F, they can move equal. And then notice any company that offers policies in Missouri would have to approve that application. All right. So these are some of the rules. And folks, my whole point in sharing this with you is that this is a danger. And yes, we got into the weeds today, but it's important to make sure that you understand the switching rules, that you understand that you need to select the right care, the care that has proven to be stable, and you do not want to miss that Medigap Open Enrollment Period. It's 6 months, and it's a once-a-lifetime opportunity in most states.